Researchers recently discovered a breakthrough in early detection of breast cancer. It is a new gene now associated with breast cancer. As medical reporter Liz Bonis shows us, one local mom wants others to know about it.
Immediately as a mom, the guilt factor sets in.
Her name is Staud, and she was diagnosed with breast cancer just after Mother's Day this past year. She's chosen to have a double mastectomy and chemotherapy. She tested negative for the traditional Braca I and II mutations traditionally associated with breast cancer and positive for this newly discovered gene mutation. It is in the PALB2 gene.
So this is a gene that's been identified as one that predisposes women and men to breast and pancreatic cancer.
According to the New England Journal of Medicine, the PALB2 mutation gives women a 1 in 3 chance of developing breast cancer by age 70. The risk is higher in women who have a family history of this disease, which is also what determines who should be tested for it.
For example, if she has multiple family members with breast and ovarian cancer, first you would think of Braca I or II. But if she has family members with a brain tumor, esophageal cancer, soft tissue sarcomas, thyroid cancers, then we start thinking potentially other genes caused this subsequent cancer in this patient.
Lori's mom, Sally, who came with her to talk to us, does not have the PALB2 gene mutation. But Lori's dad's mother died of breast cancer at age 22.
That's where the gene comes from, is my dad's side of the family.
Lori is now sharing her story to encourage other women to explore both sides of their family history. Well, we are learning more about genetic risk for cancer. It's important to note that even if this runs in your family, even if you have a positive test for a mutation that might up the odds, there are still certain interventions that over time we're learning more about. While they may not be completely able to prevent cancer risk, they can do things to help lower it. Dr. Jennifer Manders says this may include starting screening or even hormone therapy earlier for women. Lori's daughter Megan, who's now 19, says she's exploring her own proper path. She'll do what it takes, she says, because if nothing else, her mom has taught her.
You just can't, like my mom said, you can't let cancer win.
At the Christ Hospital in Mount Auburn, Liz Bonis, Local 12 News.
Now, genetic testing is not always covered by medical insurance plans. In some cases, prior approval for coverage may be needed.